I'm really, so one of the things that I've become passionate about since I started here is really clinical trial access. Um, I trained at a place, Michigan, much different patient population, right? But here, we're a very unique cancer center in the fact that we care for we're kind of community in a sense. We care for patients from the west and south sides of Chicago. But the problem with clinical trials, national clinical trials, are if you look at the demographic data, they don't represent the patients that we see every day. So I'm constantly having to extrapolate those results. And when we talk about precision oncology, I really can't say that I practice precision oncology per se. I do whatever, the guidelines say, but my patients are fundamentally, I have a different patient population than what most of those studies were all based on, right? And so one of the things we want to do here is start to understand our own patient population, right? And so that we can develop precision medicine for our specific patient population. And we've done a good job in bringing clinical trial access to our patients. Our lung cancer clinical trial program is robust. We have lots of studies. We've been able to, we have an enrollment rate that is about 70% of patients who have an actual clinical trial available to them will go on to study. And then that's about 60 to 70% Black patients. So, we're doing something right. And so a lot of, what we do is kind of to bring access to patients. And I think through those sort of endeavors, we're going to start to develop, data that will come out that will be more representative, and we'll be able to better understand how to apply therapeutics to all patients, right?